Global Health Clinic was set up to actually develop a team of very competent complementary health practitioners, experienced and confident health practitioners to cater for chronic health and to deal with a lot of the conditions that the mainstream public health system has had a lot of trouble dealing with. The cost to the taxpayer has been very high on some of these conditions like cancer and arthritis, asthma, diabetes, obesity. And some of the complementary health systems have very, very good track records in providing good cost for benefit health protocols. A lot of the modalities that are available are dealing across the range of mind, emotion and body therapy. So we have things like hypnotherapy, counselling, neuro-linguistic programming to deal with the mental and belief processes and addictions that people deal with. We have some bioresonance programs and biofeedback programs that are dealing at a quantum level and a quantum feedback level. We have standard programs like naturopathy and nutrition that are dealing at a biochemical level and at a more general health level. We have a lot of body therapies like massage and acupuncture and osteopathy that are dealing at that level of body remediation. And then we have some of the newer programs like craniosacral and body talk, which are much more subtle and work across the mental emotional spectrum. Most of our practitioners are very experienced. We've focused on having experienced practitioners. They're very confident in what they do and they're encouraged and trained to work inside a team. So a client can expect a cross-cultural environment here, and they may well work with a range of practitioners. The costs of our program, it's all a user-pays system except for what's available through the accident compensation program. But a client can expect to pay from between $80 and $165 an hour depending on the type of modality and the experience of the practitioner, depending on how much equipment a practitioner needs to use. So for a program like craniosacral or body talk, they can expect to pay $80, or massage, they can expect to pay $80 for a session, for an hour-long session. And for one of our most experienced naturopathic consultants who will have expensive equipment, you're looking at about $165 an hour. But basically with each client that comes to see us, we ideally will try to put a therapeutic lifestyle program in place. Now that will take some time to develop, and we will look to sort of question the client as to their needs, and in some respects that relates to their budget. So someone with an unlimited budget, we would really look to put together a full and comprehensive program, and they would see quite a few of the practitioners quite early in the piece, and we would look to address their health condition at a mental, emotional and physical level holistically. And we may well have the naturopath start off giving them some biochemical support, that's nutritional supplements and herbs. They may well get some body talk to deal with some of the mental and emotional obstacles that they're dealing with, or some of the stress that they're dealing with, massage for stress, and a range of hypnotherapy or psychotherapy or counselling, just to sort of look at what their goals are and some of the obstacles that they're facing in their life and that aspect of their lives. And what the practitioners will be doing is they'll be consulting with each other and the client as to the pathway we're looking to take. For people on a tight budget, we try very, very hard to meet their needs, and we think very carefully about the program we look to address with them, and it's a very consultative process we're aiming for. But a lot of it's well recognised that between 80 and 90% of what we call disease is stress related. So we'd be looking at what the primary stresses are as to how we'd address the program with them. A lot of the costs in health are in terms of the supplements, or in the allopathic system would be drugs of course, but in our case it's nutritional supplements. And because of the costs of producing these to the high standard of the products that we deal in, we will aim for people on tight budgets to reduce the amount of prepared nutritional supplements and probably aim for herbal medicine, which is slightly cheaper. And we would aim to see as much as possible a motivational program in place to sort of address the patterns they might have which would be causing them stress, and that might be inside their relationship, it may be the type of work they're doing and the way they're approaching work, it might be a time management issue. But we would really look to get the client on side with what they're doing in their everyday life that's causing them unnecessary stress. In a lot of cases it may be their diet. And we focus a lot on diet and exercise, which of course everybody's eating every day and ideally everybody should be exercising every day, but if they're not exercising we encourage exercise. And in terms of what they're eating we encourage a healthy, balanced diet. We try to get people off carbonated beverages, for example, reduce coffee and tea to reasonable levels if not eliminating it, watch the balance of meats and vegetables, and a lot of fresh food if possible. Now sugar is obviously a very, very big problem in modern society, and processed foods. So one of the things that Global Health Clinics is actually doing at the moment is setting up a food supply program of healthy natural food which would be available to our clients. Because a lot of people were asking to reduce some of the food products that are known and proven to be causing problems. Gluten is a big problem for lots of people at the moment, and dairy is a big problem for lots of people. And when you ask people to reduce that, they're not quite sure what types of foods to replace those with. So we provide people with dietary programs, and we provide them with recipes and ideas on how to remodify their existing diet. So for somebody who's not sure who to see in the early stages, our reception team is very highly trained in asking the appropriate questions. We would obviously assess things like their existing budget and their capacity to pay for services, and the last thing we want is to be stressing people out with the cost of treatment. So at the early stages of of the consultative process, we would determine who would be the ideal practitioner for the client to see first, and then in the early stage we try to map out a program, a consultative program. But at every stage we're trying to engage the client in their own health programs, and the way we've defined this is therapeutic lifestyle programs, which have been recognised around the world in cutting-edge medicine as being the ideal way for someone to get good health at a moderate cost. Now, some of the ageless systems out of places like China and India of yoga and qigong or tai chi have shown immense benefits at moderate cost for thousands of years. So there's a tremendous amount of science behind the technologies and the modalities that we operate in global health clinics. So while we've got some very ancient systems in our protocols like Ayurveda, yoga and acupuncture, we've also invested a lot into new technologies. We've got the quantum indigo machine, which is a very advanced, sophisticated system set up by scientists that used to work for NASA, and it works at a quantum biology level. And it works at the level of stress that a human being responds to according to the impulses, the data impulses that we put into a person's system using electrodes. And where there's a big response, we know that the body's over or under reacting to those particular impulses. Now everything in the universe has a frequency and a wavelength, and that's basically been measured over the years in various clinical environments. So this quantum indigo is a very, very sophisticated program. We also use the Mora 3, and our practitioner Carol Macy's had a lot of success with helping people with a range of detoxes from parasites and funguses and bacteria and whatnot, through to heavy metals and environmental toxins. And she's using one of the Mora 3 systems. So both those practitioners, Lisa Williams with the quantum indigo and Carol Macy with the Mora system, have been working for many, many years at that cutting edge level of medicine in terms of quantum biology and quantum medicine. And what they do is they complement the more traditional versions of biochemistry and nutritional medicine that the naturopaths and the herbalists have developed over the last period of medicine. Now, the difference between complementary and allopathic is, in allopathic medicine the aim is to treat a symptom. In natural medicine our aim is to look at the cause, and this is what these two quantum systems that I've just discussed now, they aim very much at finding the cause. What is the primary stressor? It will in many cases be creating some sort of allergic reaction, and that may well be from a heavy metal inside the system the body's not designed to cope with, or it may be another form of stress. So the principles behind our medicine is very much to aim to deal with the causes and to establish in the early phases what those causes are. Now we've got a range of other equipment on site. We've got a HemoView, we've got a VLA which was developed by Harvard University, and that's a Vitality-Long-Giving anti-aging program. We're able to test the thyroid using the ThyroFlex machine. We have a range of questionnaires we ask people, and that's very, very important. That's across the spectrum what your diet is, what your previous medical history is, and a whole range of health appraisal questions that will give us feedback, very, very easy feedback on how your body will be not coping with certain stresses. So there's a whole host of different ways we can help at Global Health Clinics, and our team is very, very experienced at looking to determine the most effective pathway, and what we're aiming to do is be in a very consultative process with our clients. We want them fully engaged in the programs that we're contributing towards with them, and as I've mentioned earlier on, to work at a therapeutic lifestyle aspect, not as much as a prescriptive. So allopathic medicine has traditionally aimed at treating symptoms. We are well aware of what symptoms are, however we're looking to get at a level above the symptom, at a causative level. And on that basis it's much easier to deal with chronic health conditions, because the problem with a lot of drugs is they lead to side effects, and someone can be on a whole cocktail of drugs to deal with the side effects of the primary condition. And that's obviously very, very expensive, it's very time consuming, and in a whole range of conditions it's led to very, very long-term chronic conditions that we know we can deal with quite simply and effectively using some of the processes that are available to us. It's important to realise that we're not at this stage knocking allopathic medicine. What we're saying is that it's horses for courses, and complementary medicine is extremely good at dealing with chronic conditions. There are many, many acute conditions where in the middle of the night somebody has a problem and there's no complementary practitioner available to them. It might happen on the weekend, it might happen at 2 o'clock in the morning. There's all sorts of accidents, emergencies that allopathic medicine is extremely good at dealing with, and we view that as the primary benefits from allopathic medicine. When it comes to chronic conditions, obviously we've got a lot more experience with the type of medicine we're doing, because for thousands of years the efficacy's been proven, and the costs in these treatments are very much lower than the costs involved in long-term drug regimes, and that includes things like chemotherapy and things like that. So at no stage are we knocking the benefits of allopathic medicine. We're just basically saying it's horses for courses, and we're trying, at the very least, trying to provide a choice for clients who are looking at a more natural route. So for some of the things I've discussed of some interest, I'd really like to encourage you to give us a call. Our phone number is 488-0208 in Auckland, or you can email us. We've got a very easy booking system. If you're confident about the sort of thing you're looking for in advance, you can just go straight to the website and book, or through the EasyBook system. Or if you need to discuss this, you can ring out and speak to Coombs Williams or myself. My name is John Coombs, and both of us are very experienced, have several decades of experience with complementary medicine, and we have basically trained ourselves to try and help people determine the most simple pathway that leads them into the clinical programs that are available here. So neither of us work on a clinical level, we work at that more general level. So again, I'd very much like to encourage you to come and visit us, come and experiment with some of what we've got available. Some people will give a free session as an introduction if people are unsure where they might be going. but otherwise people will very much look to sort of make the pathway easy for you to come and have your health needs met by our experienced team here. Thank you.